Massachusetts is still on track to start a gradual reopening next week, although just how open is still in question, as Governor Charlie Baker reiterated today.
This isn't going to be a situation or a circumstance where on May 18th, every business in Massachusetts that's currently closed is going to be permitted to open. It's not going to work like that. I want this to be done in a deliberate way.
So while we await the specifics, it's also important to keep in mind that some communities are more vulnerable than others. It's a point State Rep Liz Miranda has been making since the early days of the pandemic. She lost her grandmother in April, although her family is unsure whether she was COVID-19 positive. And a few weeks later, Miranda tested positive for coronavirus herself, and about 15 other relatives did too, including her father, who was hospitalized. Liz Miranda joins me now. Representative, thank you so much for being here. How are you? How are your father? And how are all your relatives?
Thanks, Jim, for having me. I'm actually on the mend, on the upswing, thank God. My dad is finally home. He's still not out of the woods yet. He has COPD and diabetes and heart disease. And so his pre-existing conditions really impacted his COVID experience. We have about 18 members of my extended family who tested positive 10 to 12 days ago. A few are in the clear. About a handful are still battling flu-like symptoms, headaches, body aches, and stomach aches mostly. The loss of taste and smell and appetite. But we're doing okay. Thankfully, we're a really resourced family, and we were able to get tested quickly and self-quarantine.
What's the age range? I mean, I know you're pretty young. What's the age
39.
range of of your family members? What's the age range of those who tested positive?
I mean, what was crazy, we have a 2-year-old little cousin who tested positive, and the oldest person was 78 years old. But we have every age range. My cousins who were in their 20s, I'm 39, like I said before. So we have every range of age. And most of us did not have symptoms. We did not have pre-existing conditions. When we got tested, we tested because my father turned out to be positive, and my grandmother had such a sharp decline right before she passed that we really felt strongly that although we were told they tested negative, that we might have been exposed to COVID-19.
Those are beautiful photographs, I should say, of your family. If you don't want to answer this, feel free. Were you able to see your grandmother? I know what she meant to you while she was ill before she died.
Yeah, we were able to spend the last week of her life with her, which meant a lot. As a Catholic family, all the rites and rituals of the faith were not allowed to be provided because of COVID-19. Yeah. We were only able to have 10 people at the funeral home, and only were able to have a priest at the burial. And we felt really strongly that we wanted to spend the last 5 days. So I take care of her mostly every day of my life for the last few years. And so we were able to have her go in comfort.
Representative, I've read you say that all the members of your family who've come down with COVID-19 played by the rules, did all of the things you're supposed to do. So what's the message in that to the public if people do what you are supposed to do and still essentially the whole family comes down with it?
I think what it says is that my title didn't shield me. I've been a state rep for 16 months. But I've been born and raised in Roxbury and Dorchester, a community that is already majority of color. We have an overdependence on service labor jobs. Most people in the district make less than $24,000. Members of my family, right after my grandmother's funeral, returned back to their working class jobs. And so what we found that the access to care and being an immigrant community, many people were fearful of getting tested. I think that led to folks, although following the rules of wearing masks and social distancing, we know that people went to the grocery stores and they could have been impacted there as well. My dad was hospitalized and returned home and was re-hospitalized, and we don't know if he brought it back from the hospital as well.
You know, virtually everybody from high positions of power to ordinary people have been talking about the disproportionate impact on communities of color. I just put up some statistics quickly, not that people need to see them. This is a look at, you know, in Dorchester and Roxbury, for every 10,000 there are 216 coronavirus cases. And in Massachusetts as a whole, as you see, only half. But at least in my experience, Representative, everybody's talking a good game. But unlike people like you, I know you filed a bill to get money in the hands of low-income people who are suffering financial hardship. I hope it passes. Are we doing more than talking about this? Are we really addressing this disparity or just blowing hot air?
We have a long way to go. In the testing location where I was, Bowdoin Street Health Center, 1 in 3 people tested positive. In East Boston, 50% of the people who tested came out positive. Chelsea, Brockton, Randolph, other cities and towns where high minority populations are all disproportionately impacted. In Boston, 24% of the population is African American, yet 42% of the deaths. What we have here is a sort of a shining light on the disproportionate nature of our public health system and our social safety net. I was heard saying, I'm sad that COVID hit my family and my community hard, but thankful that the rest of the Commonwealth was able to see how most residents of the Commonwealth are living. We're discussing reopening, and until vulnerable communities and vulnerable people have the access to care, immigrant communities are scared. You know, I passed the Safe Community, I try to pass the Safe Communities bill because we know that immigrants are not accessing testing because they're scared that ICE is going to jump out of the bushes and impact them. These are real issues, of real life and death issues. So I believe that people are working hard. But I do believe we have a long way to go as a Commonwealth to make sure we govern to protect all of the citizens of this state.
Representative, good luck with your legislation and good health to you and every member of your family. I really appreciate your time. Thank you.
Thanks, Jim.